All right. Good morning, everybody. Thank you for joining us. Welcome to Talk Tuesday, February 4th. We are just so glad that you're here to join us today. We're going to get going right away. And thank you for being so patient. A little bit of the delay. It's just some background logistics. So thank you so much. I am Christine Killiland. I'm a consultant at CERC. I'm here with my colleague, Holly Ryan. We are also here with our CSDE partners and colleagues, Kari Sullivan Custer and Jay Brown. So today we have a great presentation. It is called Connecting to Community Mental Health Resources and Connect. Sarah White is with us today, Project Coordinator, Child Health Development Institute. Gabrielle Hall was supposed to be with us today, but instead we are joined with Lisa Palazzo, also with Carillon Behavioral Health. And we are also going to be joined by Meredith Tukey, Director of Mental Health, Student Wellness, and Family Engagement from Killingly Public Schools. I'll wrap up just a minute or so of upcoming just attendance and engagement announcements. Getting right into Superintendent's Digest, there has been kind of a lot populated out within the last few weeks. If you're ever interested, though, in diving a little bit more, we have the QR code, we have the link. But just quickly to show you through, there have been a lot of things that CSDE has put forward. Even things with special education. So announcing that a study to explore a rate setting for outplaced special education services. We also have world language standards that were put out. The 23-24 school and district profile and performance reports are also released. I always emphasize those are really great documents to give you just a summary of a lot of imperative information. Attendance is also summarized in there that for that school year. But as long as demographics and academic levels, everything is in there for almost every district within Connecticut. So they're really great to check out and to really get an idea of where your school or your district stands. There is some information on AI with a pilot program. I know that has been a big buzzword for a lot of us in the field of education. So Connecticut has put out a pilot program on that. Some fiscal analysis. This is just if you're looking for some information on these various areas and entities, you could definitely check that out. And finally, this is really important. They actually put out some guidance documents for immigration activities. And what's nice is they broke it down into multiple languages to really help you. We know that immigration conversations are happening a lot in districts, a lot of guidance put out on that. So these documents will really help, but also help with these varying languages and dialects. Oh, and I'm going to stop sharing, and Kari, just let me know if you need support.
Kari, you're muted.
Thank you for telling me that. I'm not able to share. There I am. Okay, I can share now. Share. You're sharing your screen.
Awesome. Thank you, Kari. There they are.
Are you seeing, I'm sorry, guys.
No, you're good. I'm seeing the slide. Yeah.
Okay. Yeah, that's good. All right. So as I was saying, we have CSDE has the monthly attendance dashboard where you can see your monthly attendance. December has been posted. We are currently collecting the January data. We're happy to see that chronic absence rates went down a little over 1.5 points. We were about 18.6 in November and down to 17.1 in December. Just about every group saw a reduction in chronic absence in December. Not sure what's happening in January yet. Districts I've been meeting with and spoken to have been seeing an incline in chronic absence for multiple reasons. You can see here, this long line is last year's data by month. And last year in December, we were at 18.7, and this year, we are at 17.1 in December. So we are trending lower than last year. And we're happy to see that. I'm seeing that in many districts that I'm working with individually. But we know with the new administration that some of the families are a little nervous about immigration. So I thank you, Christine, for highlighting this earlier. The CSDE with the governor has issued guidance on pertaining to immigration activities and just recently issued them in multiple languages. So I put a QR code here for you to access those resources. And then a couple of other resources that have come to my attention, the family prevention plans that the Connecticut Governor's Office has put out, and then AFT has put out a toolkit as well that's very good. And so those links are there for you. I also just wanted to check in and see if anybody has had any strategies they'd like to share with working with families concerned with immigration. I know some of the strategies is providing transportation to those families who have some fear of immigration so that they don't have to walk to school, doing home visits over Zoom instead of in person. Families don't want to come out to the school or are not inclined to have people visit their homes. But just wanted to check in and see if anybody had anything they wanted to share as far as how they're helping to support families during this time. Okay, these resources are here for you, and we will be sure to continue to share what becomes available in the near
Sorry.
future. Yes.
I can share what we're doing in Bridgeport.
Okay, great. Thank you, Cheryl.
No worries. So we're holding parent office hours through Zoom for questions and answers. What we've been doing is we put out the link through Zoom. We're doing it in person as well. We're not getting as many people showing up in person, but we're going into breakout rooms with a person from either a counselor or a person from the Office of Student Services into an individual breakout room to talk to that parent individually to discuss any concerns that they have. And then if we can't do it in the breakout room, we're taking down their name and their phone number and then calling them privately with a translator. And we're doing that we did it 3 weeks in a row, and we're going to go to once a month.
Thank you. That's great. There was a district we spoke to yesterday who was concerned about ICEs in the neighborhoods. Their families are seeing them. They making sure that families have the facts and that there's a lot of rumors as well that are going around, and making sure families want the truth, like what's really happening, and how can we best support them. Anyone else want to add what they're doing? Okay, we'll move on to our presentation. Christine, you want to take it away?
Got it. Thank you so much, Kari. So I'd like to introduce Sarah White and Lisa Palazzo and Meredith Tukey. And just let me know, ladies, if you'd like me to share the presentation, I'll be more than happy, or if you'd like to do it.
Christine. Yeah, Lisa, I'm not sure what you, totally up to you, whatever works.
Yeah, if you want to share, Christine, that would be great.
Got it. Thank you so much. Just let me know next when you want me to move forward.
Perfect. Will do. Awesome. Well, thank you, everyone. It's great to see some faces and meet some folks. My name is Sarah White. I'm a project coordinator at the Child Health and Development Institute. We are a nonprofit out of Farmington working with folks across all systems in Connecticut, with the goal of bettering our children and families. So today, Lisa and I are going to present on kind of a overall the Connecting to Care grant that we're working on, and then also kind of just the systems of care work that Lisa's organization has been doing for some time. Going to bring some resources to you all, and then possibly some next steps and how you can get involved. So next slide, please, Christine. So just to kind of start out, Connecting to Care, the Connect 4 grant is what the work that we're talking about today and how schools can get involved. So I know there's a lot of school folks on the call here, starting to kind of think about if there's an interest at your school for a systems level initiative to do some planning with your school teams. And also there's paid opportunities for schools with this work as well. I'll get into more detail at the end, but essentially we just kind of like to say, these are our partners on this work. There's a lot of us here. A lot of us came together to kind of, better and move forward this Connecting to Care work. So DCF is a partner on this work. Carolyn, Lisa's organization, Carolyn Behavioral Health, formerly Beacon Health Options. I think sometimes folks know that terminology. And then my organization, CHDI. Yale is the consultation center at Yale is our evaluator. So they do a lot of our data collection and processing and give schools some data dashboards and really personalize that for them, which is really exciting. And then Favor as well. Similar to Carolyn's role, we're bringing our community folks onto these teams when we come into the schools. So Favor has two kind of roles in this. They have a family systems manager and then a family peer support specialist. So both of those folks do, their primary role is integrating families' voices into the work. So it's really great work that we're all doing together. So here is our partners. Next slide, please, Christine. Thank you. And so just to kind of give you a little purpose and like what is a system of care and what is Connect, sometimes we say these things and it might be like, well, what does that really mean, right? So a system of care, it's a variety of services, right? So in the community, in the schools, all across the system, everyone's trying to support that child and that family, right? And, sometimes there's not communication going on. Sometimes it's hard I remember I was a school social worker, so sometimes it's hard to communicate with those community providers. We do our best. But if there's not a system in place of how to do that, we just, things get away from us. So creating that system of care is kind of our goal, helping to make sure that everyone knows who to contact. And, overall, the goal is to better that child's experience in school and in the community. So how are we all communicating to make sure that we're doing that together? So that's kind of our purpose that's a system of care, right? And then our purpose with this Connect work is to really blend and integrate all of those systems equally effectively serving our children and families. We're offering support to schools through the expansion of their internal process and then also connecting their external their internal folks to the external folks, the community providers, with some community-based care. So again, we're going to go into a bit of what Carelon can offer as a community-based, provider in this work. And then at the end, I'm going to kind of give you more of like the what of Connect and how you can get involved. So I believe this next slide is going to be turned over to Lisa. Nope, I'm lying. Next, sorry. This is the goals of Connect. Sorry, there's one more. I think that it goes to Lisa. So essentially we have 4 goals, expanding the infrastructure, like I said. So this is really just connecting our community folks to our school folks. So creating that infrastructure, creating the process so that we know who to go to and who to call when we need to, refer out. So that's kind of our first goal. And then our second goal is expanding our school and family awareness, knowledge, and access to information. So we are utilizing a variety of different training platforms for this. CHDI has a platform that we use that has pre-recorded kind of like tier 1 trainings that school staff can access. We're really pushing for our paras to access these trainings. Oftentimes they don't get access to a lot of different, PDs due to their contracts. So these are pre-recorded, staff can go in. We have trainings on how trauma affects students in the classroom, how to navigate the behavioral health system in Connecticut, as a variety of different trainings. So that's one piece of this. And then Favor has a training as well that gives trainings to families. So they do a family training, in-person, virtual, a variety of different languages. They really try to, knock down those barriers to training. And schools can access that, again, virtually. They can bring them into their schools if they'd like through this work. And those trainings can be centered around understanding your child's IEP, how to advocate better for your child. So really just trying to give those families the language and the access to better advocate for their children in the school spaces. So that's a really great piece of this as well. The third piece is to build the capacity of our schools to access those services. So again, I think I might have flipped them around here. Yeah, sorry, these are flipped around usually on my slide. So typically the first one is the build the capacity. That's when I was talking about creating that system. But that first goal, expanding the infrastructure, we are utilizing a SHAPE assessment. So the SHAPE assessment is the school health assessment and performance evaluation system. There's a slide a bit later about this. So it essentially is just a big needs assessment online that schools can access and kind of get at their internal process and see how their systems are working effectively and identify any gaps in the system. So we at CHDI help our schools navigate SHAPE, read those results, kind of do something with them and create a plan to, strengthen those systems. So I jumped around a bit there. That's my bad. But overall, fourth goal, just sustain over time, right? So how do we sustain this when the work is done? Our grant does last through September of 2027. So we have the capacity to work with schools for 1 year, or they can re-sign on and we can work through September of 2027. But once that is over, right, what does it look like after, CHDI support leaves? Carillon, Favor, all those community folks don't leave the school, right? Those relationships are being built through this work so that after the work is done, they're sustained over time. So that's a big goal of ours as well. All right, and then I think our next slide should be handing it over to Lisa. Yes. Sorry, I jumped around a bit there.
No worries. Thank you, Sarah. And good morning. And thank you for having us. My name's Lisa Palazzo, and I'm filling in for Gabrielle Hall today. I'm a network of care manager in the North Central area. And I believe my colleague, Jules Calabro, is also on the line, who is Region 5 network of care manager. So we're going to be doing a high-end overview of how to access some community mental health resources. And if you want to go to the next slide, one of the first resources that we wanted to share with you all is the Connecting to Care CT.org website. And so you can scan there, but you'll get these slides afterwards as well if you want to take a look at it, because that website does have a lot of great resources. It was developed in partnership with the grant partners that Sarah mentioned, and in partnership in our previous work on the Connecting to Care site. And I'll provide you with some tips on navigating it. And again, you'll get these slides afterwards. So if you go to the next slide, and that will just show you what you see when you go to the homepage and you scroll down, you'll see quick navigation links, and that will start bringing you to some of the different pieces on the website. The AIM tool, resource list, how to connect to care. And so that's one way to access them. And I'll talk about those sections in a bit. And if you scroll to the next page, you'll also see at the top there, you have a toolbar that will also bring you to different sections of the website. So if you click on support and services within the website, that's going to bring you to information, not only on where to find resources and supports for mental health care for kids and families, but also on how to understand all the different levels of care, because we do have a lot in Connecticut. And so what is the difference and nuances between those levels of care or services? That's available there on that tab. And then if you scroll to the next page, you'll see trainings and information. So, so here, as it sounds, you'll find information on trainings. Sarah had mentioned one of the grant partners, Favor. Those are trainings that are available for families and providers and caregivers. So those are available there as well as some additional trainings. Then on the next slide, you can get additional information by either, again, scanning that QR code or clicking on the link to join our mission. And that will get you to our distribution list, which you'll receive additional information on resources, trainings, and get connected to different systems and levels of care through that link. All right, and on the next slide, I'll start diving into how to navigate mental health supports. Again, just a broad overview of that. But if you click on the next slide, one tool that I do want to highlight on the website is the Connecting to Care website is the AIM tool. And this tool helps youth and their families get matched to the right treatment. And so on the next slide, we know that Connecticut has a lot of different options and services to provide support for mental health and substance use services, and it can be difficult to understand. And so the AIM tool can help navigate this system. And so if you click on the next one, just a disclaimer, the AIM tool is not meant to replace any expert consultation or even a referral process. but what it will do is provide guidance on how to narrow down out of all of those services, which service best matches the child or family's needs. And so you still want to consult with others as appropriate, but what it will do is not only match the youth to a specific service, and that's based on a few questions that you or the parent or whoever would answer about the kid, but also give you information on where to find that specific service in your area and contact information on how to make the referral. And so, the other benefit of the AIM tool in the process is the more you utilize it, the more familiar you become with different services available in the state and start kind of teasing out and navigating that system. On the next slide, it will show you that there's 3 pathways to utilize the AIM tool. So one is a parent or caregiver, one is for DCF, and then provider. And then school professionals can utilize the provider link. I also utilize that link as well myself. And again, there's a series of questions under each of those 3 decision pathways, which will lead you to getting the correct matched intervention. On the bottom of all of these slides, I want to mention you'll see Wheeler, DCF, and the Connecting to Care initiative there. And that's because Wheeler was our partner with DCF in the Connect grant on this work specifically, and Dr. Elizabeth Kanata helped to develop this. The next slide will give you additional information about the website and where to find it. So within the Connecting to Care site, again, that service and support tab that I talked about, it does have a link directly to the AIM tool, but there is also, again, on the navigation, on the homepage, on those navigation quick links, you'll also find the AIM tool there as well. Next slide. So that was just a high-level overview. We do offer additional trainings on accessing mental health supports and trainings on how to connect to local providers. So if you're interested in any of these trainings, Sarah's going to talk more about how to join the Connect 4 initiative and how to receive additional support. And these trainings are available. The Network of Care Management team at Carelon Behavioral Health can provide trainings on kind of a deeper dive into this Connect site and all of the resources that are on there. I'm going to talk more about some of the different pages as well. But this will give you a deeper dive into all of them, how to connect to providers, substance use or suicide prevention resources, and a whole host of other trainings that are listed there. So next slide. So I'll jump in a little bit further onto some of those community-based resources because we know those can be helpful. And with the next slide, I'll talk about one of the newest programs that you might not be familiar with, Community Pathways. So this is new in Connecticut. Anyone can utilize it, regardless of insurance, and it is free. It's a warm line that helps families or providers navigate the system. And so really, if you aren't sure how to get started, this is a good place. It's not a crisis line. So we'll talk more about that shortly, but you will get connected to a licensed clinician that can help assist on community resources and evidence-based practices. And so you would just call that number on the screen. Again, it's available to anyone and it is free. The next slide. The resource list can be found on the Connecting to Care site under the Supports and Services tab. So each region has specific providers that you can connect to for mental health and substance use resources in the area. And the nice thing is they're available in 11 languages. Next slide. So for care coordination, this is across the state. And again, information is on the website for further information about where to connect. Different providers or different organizations provide this throughout the state. But they provide high fidelity wraparound services and support to children up to 18. And they develop a plan of care really centered around the family's goal and vision. And the goal is to maintain these kids in the community and within their families. And then on the next slide, you'll see similarly, but intensive care coordination program This is for kids that are experiencing more intense mental health needs, such as maybe transitioning back from residential or in and out of the hospital often, that need that care coordination support. Here, DCF can also refer to this program where they cannot refer to the community care coordination. But they utilize the same wraparound philosophy and trainings and care planning, and information on intensive care coordination can be found on the Carillon Behavioral Health CTCFD website. Next slide. All right, so I'll jump in a little bit further, as I said, about the crisis intervention and prevention resources, which I'm sure many of you are familiar with. But again, on all of these topics, I am doing it a little quicker so that we can have a discussion and doing a high level overview. But Sarah is going to talk more about how to get additional information and support, which we would provide. And again, this is just an overview of the crisis supports. So the next slide is some of the crisis intervention supports in the area. So I'll dive into UCCs a little further, but the urgent crisis centers. We have our suicide and crisis line, 988. The crisis text line is available, mobile crisis, the 211, and then Trevor Project for LGBTQ+ youth who are struggling, and then of course 911. The next slide will show you the different urgent crisis centers. There are 4 across the state. Again, all of this information is on the website as well to find additional kind of more in-depth information, but these are walk-in clinics for mental health related concerns, and they'll provide immediate assessment and access to resources. Most insurances are accepted. Parent guardian is needed for urgent crisis centers. Understanding that there's only 4 across the state and they might not be, conveniently located to all across the state. On the next slide, we also have youth mobile crisis intervention services, which again, I'm sure most of you are aware of. It can be accessed in Connecticut by calling 211 or 988. And so that's for kids up to 17 or 18 if they're in school, experiencing a behavioral health crisis, and they can provide rapid stabilization, assessment, and connection to care. And they can respond in the community setting, like schools, unlike the urgent crisis centers where they have to go to the urgent crisis center. Youth mobile crisis is mobile, and more information can be found online. There's a website link there as well. On the next slide. And then this is just a handy reference on when to call mobile crisis first. 911 will sometimes get those kind of questions. And I know that's probably distinct on different areas. But in terms of when you would call mobile crisis first 911, if they need immediate police intervention or medical attention or anything like that, you would be contacting 911. But mobile crisis can also respond even if 911 has been contacted. And on the next slide. So this is the network of care team at Carillon Behavioral Health. As I mentioned, you have a couple of us on the call today, and we cover the full state. We're broken out by DCF regions, but we also like to say the area of the state because that makes it easier as we don't all use the same, region numbers. And so we have one for the Southwest, the South Central, Eastern, North Central, and Western area and Central area of the state. And then we have a general mailbox as well. You can contact any of us for additional information, to connect to community-based resources, or if you just have questions on mental health resource or the system, if you want to connect to local community collaboratives or different tables that you can become involved in and get additional information and training, you can contact us. And then again, Sarah's going to talk about additional information on joining the Connect 4 initiative, which would provide you additional support from us as well. The next slide, I think, is going back to Sarah. Yes.
Awesome. Thanks, Lisa. Before I go on, I did see in the chat, I was going to answer this, but I'm not 100% confident. I believe they're referring to the community pathways. Is that available in different languages if someone's speaking English or does not speak English calls?
It is, yes. Community pathways, we have Spanish speaking staff, but we can also utilize translation, interpretation services, excuse me, if needed.
Awesome. Thanks. I just didn't want that to get lost before I moved
Thank you,
forward.
Sarah.
Yeah, no worries. Awesome. So thanks, Christine. If you could just go forward to this next slide. So to kind of circle back to Connect, the Connect 4 initiative, this is all information that you would get through this initiative, bringing our network of care team to these meetings. They'd be more specifically tailored to your region. So as Lisa mentioned, there's 5 or 6 network of care managers for our 6 regions. So they are a part of these teams that we bring into the schools as well. So I'm going to kind of give you the who and the what and the how of Connect 4. So really kind of talking about this systems level initiative now that I was referring to at the start. This is kind of our team that we start with at each school. So for those that are on the call and are kind of thinking, oh, this would be interesting for my school, I just want to say, so the who is public and magnet and charter schools in Connecticut. We're actively recruiting right now. And we identify about a small team in each school. Again, this is a school level initiative, not district wide. You can sign on with all of your schools in your district if you like, but you don't have to. It's kind of up to the school's need, interest, and capacity. So at each school, we would identify a team of about 5 to 6 people. That would be a social worker, a school counselor, a school nurse if possible, a classroom teacher, an administrator. So just kind of getting all the different perspectives of the school team in the room. And then we would bring in our team to those meetings as well. So myself at the top there, you'll see the kind of the CHDI internal support. So we guide through SHAPE. And then you'll see the network of care managers. They come to those meetings as well, kind of speaking to the external piece. I see the question just pop up right now. I'll just share this is free to schools to participate. Thank you for that question. And there's also paid opportunities as well that I'll get to in a bit. So the network of care managers will join, as well as the family systems managers and the family peer support specialists in that region as well. So that's kind of the who all coming together to do this work. And I did see that question pop up and now I forgot. Yes, you can use an existing team. We often do ask our schools if you have a crisis team already that meets, that's a great team to tap into, SRBI team, whatever that looks like. If you have to add a few folks, just kind of not trying to reinvent the wheel or make more work for you, that's definitely best practice to kind of tap into some existing teams. And then if we're available at those times the teams meet, we'll do our best to come during that time. Essentially, we start out our first meeting, if we can, we do our best. Our kickoff meetings, we call them in person. But then, most of us are working kind of across the state in various different parts of the state. So we may do virtual meetings as well. So just to kind of give you an idea of what that would look like. And then the next slide. Now that we kind of know the who, this is kind of the what. This is somewhat of our timeline. As I just referred to the kickoff meeting there. So essentially that's your project rollout meeting. We would come to the school, get to meet the team, talk about what this work looks like in more detail, because there is a lot. I'm going to do a very high level overview right now. But essentially we just come in, introduce every person that's at the table. So our Carillon and Favor folks, our Carillon folks would do a very, very brief level overview of what Lisa just gave, again, to your school teams. So it would get to your teachers, it would get to your social workers, your counselors, kind of just getting at different folks in the building, spreading that information along. Sometimes I think our mental health staff hold a lot of this information and it's hard to get it out to the wider staff, so we can help with that. And then once we move past that kickoff meeting, that's when SHAPE would start. So we would guide our schools through what is SHAPE, how do you access it, what does it look like online, and how do you complete the assessments. We give our schools about 2 months to complete SHAPE. It does take some time, but we don't suggest that schools sit down and do it all in one sitting. What we would say is, again, tapping into that existing team. If you already have a team, maybe you complete a few questions at the end of each meeting. You can save your progress and go back. So maybe at the end of each meeting, 10 minutes you dedicate to a few questions. That's kind of best practice. We don't want you to get inundated with just clicking questions and, then you kind of lose what the focus is. So SHAPE can be done. I've had some schools do it relatively quickly. Some schools take more time, totally flexible. It would just determine, you'll see at the bottom, the level 1, 2, and 3 schools. The time that you take to complete SHAPE kind of determines what we can do with that. So the next step would be to review those results with our team. We would bring a nice, concise report to your team and say, this is where things fell in SHAPE. And then schools can kind of decide, okay, there's really something here. There's something internal that we'd like to work on. Shape has a bunch of different domains. I'll kind of speak to those in a second, but we would pick one of those topic areas and build an implementation plan for your team. So us at CHDI offline, we would kind of write that up, kind of some action steps and goals, and send that out to the school team. They can provide feedback. It is a living document. We can collaborate on that together. And then essentially the school has that document, that implementation plan, to help guide their focus for the rest of the year and say, okay, maybe the goal they identified was, our SEL program is just not, it's not what we want. It's not getting our kids what they need. Our students aren't accessing it. It's not effective. There's no data process to collect if it's working or not. So, just going with that goal, there's a variety of different ones, but just going with that, you would have that plan to say step by step, okay, maybe we start with a big resource map of like, what else is out there? What other SEL programs can we access? How much do they cost? What do we have the ability to take on? And just kind of going through those steps of maybe identifying a new program. So that's an example of what one of the implementation plans could look like. And then level 3 schools would essentially, there's a lot of other things at each level, but essentially level 3 would just mean that you get to continue meeting with that whole team monthly and checking in on how things are going. Obviously, we know in your schools, you're probably already meeting with that team. So some schools think level 2 is a great fit. A level 3 school might say, we do need that kind of outside support to help us move this along. So your CHDI staff, your Carolina, your Favor staff would make sure that we're setting those meetings, we're coming to the table, and we're checking in on that progress. It's just to help schools move along more effectively. So that's kind of the timeline. If we could go to the next slide, Christine, I believe. Yes, so to speak more about SHAPE, I mentioned it's a public access website. All schools can access it. You can complete SHAPE assessments at a school level, a district level, at a state level, if you should like. It is housed by the National Center of School Mental Health out of the University of Maryland. So CHDI has a lot of connection with those folks that kind of house SHAPE. So if there's any technical issues, we provide a lot of technical assistance and support with the system, which is a resource to have. SHAPE has a big resource list that schools can access when they sign in. So you can create an account really easily, sign in, and you'll get access to this really awesome resource dashboard, really, where you can kind of tailor, I need resources on screening, or I need resources on school climate measures, or just kind of like tailoring through what you might need. So they have really great resources. And then I mentioned there's 7 domains that SHAPE kind of looks at with the assessment. So maybe I can name them all right now off the top of my head, but there's impact, which is data collection. They go into MTSS tier 1, and then tier 2 and tier 3 are kind of lumped together. Screening, your teaming, I'm going to forget the last few, but essentially it goes into all different areas of a comprehensive school mental health model. And it uses a Likert scale. So it would say, just taking teaming for an example, it would say, on a scale of 1 to 6, 1 being not at all, 6 being we do this really well, how well are we communicating across our teams, right? Our system. So how well are our teachers communicating with our social workers, our counselors, is there that collaboration going on? And then that school team would get an opportunity to say, I think we could be doing this better. I think we could be at like a 4 or a 5. And then, somebody else might say, well, I think we actually might be at a 3, and kind of giving your input as to why you feel that way. So the conversations that come out of the SHAPE process, I've heard from school teams are really valuable. So we love this resource. We kind of use it at the start of all of our processes with schools. It kind of helps to guide the work, which is really great. And then I think this might be one of the last slides on Connect. Yes, so this is a lot here. You are going to get these slides, and I can share this flyer with you all individually as well. But I like to share, this is the back page of our flyer, just because it really breaks down what is associated at each level. So you'll see level 1, the trainings, it's kind of all listed there, but it's really just SHAPE and trainings. And then level 2 is where schools can really take on that, implementation plan, really do something with those SHAPE results. And then level 3 is that monthly technical assistance, and there's other things associated there. So I won't go into too much detail about each task. If there's specific questions, I'm happy to meet offline or answer those. But one of the reasons why I like to share this graphic as well is because when I mentioned the paid opportunities for schools, this is really where you can kind of see it outlined really well as you complete each of those kind of like bullet points there under each task, you'll be able to invoice with CHDI and a check will be given to the school for that work. So that's kind of that process. It's like an incentives-based process. So as schools complete the work, you will be able to receive money. If something's not done, you just don't get the money. That's kind of the process that we've identified, just, you know, flexibility with our schools. We know that every school is different in what they can take on. So it's kind of like choose your menu, what you can do, and then with that, you'll receive that funding. So I just wanted to speak to that portion as well, because I know there was a question about the money. And then I think this next slide might be, yes. So we wanted to, Christine actually asked us to do this, which I thought was a wonderful idea. We do present Connect a lot to different tables. I do have some experience working in schools, but you know, sometimes it's great to hear right from the people that are doing the work in the schools. So we reached out to our existing schools, asked if anyone would be willing to come and just speak really briefly to how the work is going. So we have Meredith Tukey here right now. She's the Director of Mental Health, Student Wellness, and Family Engagement at Killingly Public Schools. I believe she sits on so Killingly has signed on with all of their schools in their district. They're one of our big districts, which is wonderful. I believe she sits on most of those teams. So Meredith, if you are here and would like to just give us a brief kind of explanation of how things are going with your teams, that would be great. And yeah.
Hi, yes, I'm right here. Yeah,
Hello.
thank you for having me. We've had such a great positive experience working with the Connect grant, and we work with Rosie. Again, there's 5 schools in Killingly participating, preschool up through grade 12. And one thing that I think has worked really well for each of the schools is they're all doing it a little bit differently, and that's okay. One thing that's really wonderful about working on the Connect program is that each team at each school is different, and that's okay. Rosie works with each team. They're comprised of different people. Each team in each school is at a different spot of kind of where they're at. Some schools are taking a little bit longer to complete assessments and determine what level they want to be on. Some schools are really quick and right there, like they're already had their implementation plan and they're working really hard on that. So the flexibility and the understanding that we also are in a school and we have so many other initiatives and assessments, and teachers are, as we know, and counselors and social workers are already very overwhelmed. But I think, oh, sorry, my lights just went out. I think one thing that has been super helpful, I think anyone in schools can appreciate this, is that we always want to do these things. We always have these super great ideas. And I think sometimes what gets in the way is the follow-up, because all these other things come into play and we can't follow up with it, or we're really not sure how to access the information or what to do about it. So Rosie's been really helpful in helping us organize our ideas, helping us organize our priorities, and helping us kind of plan how we want to execute those. And also just being very patient at the same time, knowing that there's so many moving parts in a school. So, I mean, if anyone ever has questions for me, I'm happy to answer them, but we really enjoy just the organization, the expertise, and the patience and the follow-up has been very helpful for our schools.
That's awesome. Thank you, Meredith. Yeah, I agree. I think sometimes our role, and again, I know this feeling of being in a school, but sometimes it is just sending that email again and again saying, hey, let's connect, let's set that meeting. Just helping you all create that time and that space, I think sometimes is huge. If there is any questions right now, if anybody has any, feel free to put them in the chat. But one thing that, Meredith, I'm not sure how this is going for you all in Killingly. Again, she mentioned she works with my colleague, Rosie. But I found, since Lisa is here as well, just the connection, bringing the community folks, the network of care managers to the teams. How has that gone for you all so far? And I believe you all might have done one of the trainings through Carelon. Is that correct?
Correct. Yeah. So during one of our professional development days, we had Drew LaValle come from Carelon and work with all of our school counselors and social workers about the community resources and how to access them. We have In, northeastern Connecticut, there isn't a lot of resources and a lot of families who are in need and wait lists. And so he really helped the school counselors and social workers find tools to go to help families get the resources that they may need, and also just connections the counselors and social workers can make to talk through like a situation that they're going through. Like, what type of care do you think this person, this family needs, or this student needs? And then we're also having, I don't know if this is part of it, but we're having a representative from 211 come in a couple weeks to talk about all the 211 services. And I think at every school, although I can't be totally sure, but most schools are every school is participating in those Educate Smart videos. So they are doing the trainings through those, and they find them helpful.
That's awesome. Thank you, Meredith. Yeah, that's great that Drew has brought that to you all, and the 211 resource sounds great. Yeah, and so Educate Smart, I don't believe I mentioned it by name, but so that is the trainings that we offer, our pre-recorded trainings as well. So that's something that schools can get access to through Connect as well. Awesome. Thanks, Meredith. I appreciate that. And I believe our next slide might just be questions and thoughts. If anybody has anything, feel free to reach out. My information was on that previous slide, but I can also put it in the chat as well. Yeah, does anybody have any thoughts right now or questions?
And please feel free to unmute, put it in the chat, raise your hand, whatever works. We'd love to hear from you. There is one in the chat, I did see. Do you have tools to help schools convince families to get the support?
Yeah, because that's often a big, I understand that question wholeheartedly. My thought would be that our favor folks, just thinking of some of the family systems managers that I work with through this work already, they are great at that. They are great at saying to the families, this is your child, this is really important, getting them to the tables. I know they're open to creative ways of accessing families, calling them, getting them in the building. Over in Hamden, we're already talking about doing a kind of wellness day for our students and our families. So they're coming in, getting some, possibly some food, some great things. And then we're going to target them there and say, hey, now that you're here, why don't you participate in this training, right? So really trying to get at them in the ways that they're able to come to us. So I think that's the beauty of this work is we get to be creative. So, at a meeting, we might be able to say to you, well, what's the biggest barrier for your families, right? Because I think that's a loaded question. How do we get them engaged? So we can definitely, if the work starts in your school, we can start talking about different creative ways to access them. Thanks for that question.
I think this is Meredith again. One thing that's interesting for us to learn more about is one thing that Drew talked to us about is that in favor, I'm sure does this too, is that we can set up families with another family who's been through a similar situation and or who have children in similar situations, so that the families can talk to each other. And that is another resource that we learned about through Carillon.
Awesome. I love that. So I often rely on my partners through Carillon and Favor to come up with those creative. That's awesome. I love that idea. Thanks for sharing that, Meredith. I did see somewhat of 2 more questions in the chat. So first steps for participants to get more information. So, again, reach out to me. I do the recruitment for this work as well. So next steps would really just to say, hey, I'm interested. We could do a separate call one-on-one if that's something that feels helpful. Talk about like which schools in your district might be, the biggest, the easiest to target, I guess I would say. Maybe it is all, maybe it's just a few. And then we often say, at each school, if you're not like a school counselor or a social worker, or maybe you're an administrator, try to bring that information to those folks so that there can be buy-in there, right? Because they're kind of owning the work in the school building. And then it's just an application process, pretty seamless, just gathering information about the school. We would contract with the school. So a contract would go out from my contracts manager to your superintendent, get that signed. Really just kind of stating the work is being done, and that is giving us the ability to compensate you all. So that's somewhat of a process that doesn't take too long. Some districts push it towards their Board of Ed, get it looked at, things have gone smoothly with that. And if there's any questions on that process, again, please feel free to reach out. I'm just going to keep going down through the questions in the chat. Is the whole school involved in the SHAPE assessment? Just the designated team. I will say something I did forget to add for our higher level schools, so middle and high, if it's possible that they want to get a student on the team to get student voices. And then I know one of my Waterbury schools has a family liaison on the team as well, so getting that family piece to kind of speak to the questions. But yeah, we try to keep it under 10 just because, whole school completing that might be a little difficult. Let's see. Also, Christine, stop me. I don't know if I have time to move through all of these, but I'm happy to.
Nope, you're good. You have another about
Okay.
8 minutes. So as you
Awesome.
please, go right ahead.
Cool. Awesome. Certain parts of the state where gaps in service have been identified. Plans to build. Yeah, I would think, just from so Rosie, who Meredith referenced, that works with Killingly, she's working with a few other schools in our eastern part of the region. I know that I grew up over there, so I know that there's often some, scarcity in resources. I'm not sure if their plans were identified to, create a system to identify supports, but that's a possibility for sure. Not sure if Lisa or if anyone wants to jump in and
Yeah,
kind of speak to that.
I
Yeah.
can jump in too. We didn't get into this too much, but again, like it is available for additional trainings if people are interested, but there is a whole system of care to support the children's behavioral health planning in Connecticut. And so the network of care managers role is to help identify these gaps in services and to help kind of, if we can, creatively problem solve and to talk to our community partners. There's different community collaboratives on a local level where we can bring this information and see how as a community we can respond, but also bubble it up on a regional and statewide level as well to those system tables. So there are recommendations that are made in our Children's Behavioral Health Advisory Council report yearly that go to the DCF commissioner, which include, many gaps in services and different concerns and needs for kids and families. So there are avenues to pursue that. Yeah. Systems work takes time, but there are avenues.
Absolutely. Yeah. Thank you for that, Lisa. Corey, I'm curious if you could put in the chat what district or school you're from, but I'd be happy to, we could talk that through more and see what that would look like for your school. Sounds like you're often looking for those resources for bilingual supports. Favor and Caroline, I think, do a great job of really broadening that to different, folks of need. And then last question, I see you're in Westbrook. Awesome. Does the compensation go to the district or the school? Great question. It does go directly to the school. However, the way our process works is that we would receive a W-9 from the district, or I asked my contracts manager this recently if it could be from the school as well, because the check will go to whoever the W-9 is written out to. So currently, I have most of my schools have it going to the town. I know every town's different. I haven't had an issue yet where they can't get that check over to the school, but ideally that would be the process. I did have a school tell me that they thought that would be an issue, so we're trying to troubleshoot that and see if maybe we could get a W-9 to the school just so it goes directly to them. But that's the process. And again, we're happy to be flexible if you say to me, yeah, that's going to be an issue. We'll figure it out. So I appreciate that question. And any others? Happy to, again, coordinate offline or, connect offline. That's the word I was looking for. Feel free to reach out. But thank you all for your time and
Can I
hope to hear
ask
from
one
you.
more question?
Yeah,
I feel like I've been
absolutely.
monopolizing the chat, but nobody else is jumping in. So now I heard you talk a lot about systems approach and like MTSS and tiered
Yeah.
support and things. One of the things I've been interested in trying to get started, but it's kind of overwhelming. I'm at a few different schools, but one of them is Prince Tech in Hartford.
Okay.
And I've been looking to try to incorporate restorative practice into substance use and offering that to students as a way of kind of like deferring discipline, like, and instead of suspensions, like instead of getting out for like a 5-day suspension or a 10-day suspension, come and do this program and like this educational program type thing. That way, like, just it's on their terms too that they're attending, and it's not something that's compulsory or mandatory, because their buy-in would might wane with something like that. But if you offer it as an incentive or interest, Is that something that would come from that shape assessment as well?
Yeah, so you're already speaking to, you're saying restorative practices and things. My wheels are turning. CHDI has another program called the School-Based Diversion Initiative, SBDI. So we, on that realm of things, we do a lot of restorative work with schools. I would actually think that that could be a good fit for you all, and I'm happy to talk about that offline. But the shape assessment is embedded to SBDI as well, but also, you know, that's definitely something that would be identified. Through Connect, we do 2 different assessments. So there's the quality assessment, which is the pretty overhaul assessment, and then there's the CARE assessment that is new to SHAPE and to us this year. So CARE is kind of the culturally responsive, anti-racist, equitable practices. That assessment goes specifically into discipline practices. So it will ask those things. Are your discipline practices effective? Are they equitable? Not even just across your students' race and, you know, equity, but all different kinds of things. And then, yeah, you would get a result from that, and you could use those results to maybe advocate at the higher level, like, hey, we need this, right? So SHAPE can definitely be a good advocacy tool for schools.
Thank you. I will be reaching
Of
out.
course. Absolutely. I love it. Thanks so much. Great. Cheryl, I see. Yes, let's definitely chat about SBDI. I'm going to put my email in the chat just so it's easy to copy, but I appreciate all your time.
Awesome. Thank you, Sarah, Lisa, and
Yeah.
Meredith. This was absolutely fantastic. And we'll make sure to get this information out to people so that you have this information and take it back to your schools and have the conversations. So we are so thankful that you can join us today. And just to wrap us up super quick, just our remaining Talk Tuesdays for the year. Hard to believe to say there's 6 left, but the year does go by quickly. So March 4th, we will be here again due to President's Day and the varying times that people have off. That's why we're taking a little bit of a break for the second one in February, but then we will regroup come March 4th. Again, if you have anyone you know that would love to join us for Talk Tuesday, please share the registration link with them. Please do not share the Zoom link because we want to get them to register so that they can get all this great information as well. So please, if you can forward that along. And we always say for Talk Tuesday, it's never too late. Even if it's towards the end and someone would like to join, forward them that registration link. That would be great. And our contact information is here. If you have an idea, if you would like to join us ever to share something your school or district is doing, or just want to contact us with a comment, question, here are our emails and our contact information. Please always feel free to reach out. Again, we thank you all for your time. We thank you, our presenters, and we will see you again on March 4th. Have a wonderful day, everybody. Thank you for joining us.